Hello, and welcome to the Orthodontic Products Podcast. I'm your host, Alison Werner. We have a special episode this week touching on a timely issue that may be affecting your community and your practice, specifically the rise in measles cases in certain parts of the United States. To break down the current situation and what the orthodontic team needs to know to protect staff and patients is infection prevention expert Jackie Dorst. Jackie, thanks for joining me today.
Thanks, Allison. It's always good to share information with your viewers.
Great. Well, so I know this is a topic that came up recently on the AAO Staff Club Facebook group. So some of our listeners may be aware of the outbreak in Florida, and more recently, there have been some cases in Michigan. Can you talk about what's currently going on?
Yes, the Michelle Ritterskamp with the AAO, who manages the AAO Staff Club, had read about increasing numbers of measles cases in the United States, and she contacted me and she said, "Is this a concern for ortho offices? And if so, is there some information that we should be sharing?" And so I put together a short informational posting to include on the staff club webpage or Facebook page with them about the current status of measles infections in the United States and concerns for the orthodontic office and how we can manage these potential infections if they had an outbreak in their community. So it was very timely information as it seems like daily that I'm getting updates from both CDC and in the news media about measles cases in different communities.
Okay, so let's talk about measles. It actually was declared eradicated in the US in 2000, but there have, of course, been outbreaks since then. They are increasing. So, what do we need to know about measles?
Well, measles is caused by a virus. It is an airborne transmission of the virus, and it is the most highly infectious of airborne transmitted diseases. We learned about R naughts, the infectivity during the pandemic, and it has an R naught estimated between 15 and 18 and is used as the standard really for how infectious are airborne diseases. Measles is a childhood disease that is vaccine preventable. The vaccine is very effective, over 90% protection from it, but we have to have vaccination of 95% of the population to provide that herd immunity. So, with the pandemic interrupting socially and healthcare wise vaccination rates, we've seen a drop in the vaccinations, and even prior to that, for whatever reason, there have been communities where vaccination levels have dropped below that 95%. And since 2000, there have been a few years where there was an incidence of a few measles diseases with it. And I believe the year was 2014, just to give you an example, Allison, that there was one child who visited Disneyland in California that was infected with measles.
Yeah.
And within 14 days, there were over 800 cases of measles that cropped up because of that one child, the zero patient, if you will, being at Disneyland. So we've seen, just a few cases, again, of this vaccine preventable diseases until 2019. And then in 2019, it was as if the herd immunity was lost. We dipped down in enough communities that there was a peak in infections. And in 2019, there were actually 1,274 infections.
Okay.
And the public health, was concerned. And then what happened? We had the pandemic. And all of the respiratory protections that was implemented with wearing masks, hand hygiene, fresh air in the office, and air filtration to prevent COVID transmission prevented respiratory diseases in general, both influenza, colds, RSV, and potentially measles with it.
Okay.
And we didn't see another incident. Now, as we've exited the pandemic, we're in our new normal with it now. People have dropped precautions.
Right.
And we're getting out socially, and we're going to sporting events and entertainment events where there's crowds of people and traveling a lot more internationally. And yes, Measles was supposed to have been eradicated from the United States in 2000, but not globally.
Right.
And that's where we've seen there are other countries where there are higher rates, such as in India and England, that we're seeing higher rates of measles transmission. And with travel, then you can have patients come back to the United States that acquire an infection. Unvaccinated people, even adults, are at risk of an infection, but especially infants. An infant under 1 year old, they don't receive their measles vaccine, their MMR vaccines,
Right.
measles, mumps, and rubella. All three vaccines are given when the baby's 1 year old. Younger than that, they have their mother's protection with it, and their immune system hasn't developed enough for them to produce antibodies with it. So that's why that vaccination is scheduled for the 1 year mark on it, and babies could get infected during that international travel with it. So, highly infectious airborne disease.
So, what are some of the symptoms that people should be looking out for?
Well, like all virus respiratory diseases, that cough, you can have a cough with it. Runny nose. Oh my gosh, that is one of the first symptoms that you'll see, and a high fever. Fever will run up to 104, possibly 105 with a measles infections. But for us in the orthodontic world, in oral health, one of the first symptoms will be lesions inside the mouth
Ah,
before they might even develop the cough or the fever. There is a unique oral lesion called a Koplik's spot. And I think you've got some photos of it that you can bring up with us for our viewers to see with it. And they'll usually be on the inside of the buccal mucosa or on the soft palate. So that's one of the things that I would encourage ortho offices, if you hear of one or two cases even in your community, start doing that oral exam. You know, when we look at a patient's mouth, the first thing they're going to look at is the alignment of the teeth. And are there any brackets off? And,
yeah.
are we changing arch wires today, or are you due for a new aligner with it? But look on the inside of the cheek, look at the soft palate, do that quick oral soft tissue exam. And if you see any of those Koplik's dots, then definitely that's an alert. I would segregate the patient into another room, even, not even in the open bay area, because this virus, with it being an airborne disease, it can stay suspended in the air for up to 2 hours after an
Okay.
infected patient is even sitting in the reception room for 15 minutes or in the open bay. So you would want to segregate them immediately, and then dismiss them and reschedule them for another appointment.
Right.
And just say, we are suspicious of this. Looks like we're not definite. Please go see your doctor. And because we don't have airborne isolation rooms in our ortho office, so you don't want to
Right.
put the rest of the team or other patients at risk.
Okay. And then what are the complications with measles?
Well, a measles infection, we think of it as a childhood disease, and you're sick for a week or so, stay out of school. I was born before 1957, which is the year that the measles vaccine was introduced in it, and we saw mass vaccinations starting in the 60s with it. And CDC says that anyone born before 1957 is assumed to have acquired immunity, having had that infection.
Okay.
And I remember when I had it. And one of the things is having ear complications with it. The infection can actually affect the ear and cause hearing loss, that is a lifelong hearing loss, or affect the eyes. I remember both with chickenpox and measles, my mom said,
Right.
hey, I've got to stay in a dark room. You're not going to play outside in the bright sunshine while you have that ocular eye infection. And of course,
Okay.
it's the rash over the full body. The high temperature can be a risk with it. And it can be, there are fatalities with it. Not a lot. It's, maybe 1 in 1,000, and it's usually from complications such as developing pneumonia. So initially, the cough, runny nose with it, and the high fever. And of course, like any viral infection, the aches and pains, the fatigue with it. But those oral lesions are a real early symptom that we can identify in our orthodontic practices.
Okay. So you talked about the oral exam and those oral lesions. So what can staff do? What can the ortho team be doing to protect staff and patients?
Well, let's go back to what we learned during the pandemic, and it's about protecting against all of those airborne diseases. I mean, I'm going to call, and CDC refers to them as ILIs, influenza-like illnesses. So flu, RSV, colds, all of those diseases that can be transmitted in the air, then we want to take precautions. So number one, how's your heating and air conditioning system working? Is it at its maximum efficiency? You want to have at least 6 air changes per hour. When have you changed your filter on the heating and air conditioning system? We learned that a MERV 13 minimum efficiency reporting value provides at least 50% filtration of 0.3 micron size particles, and that should be changed on a regular basis. I can't give you how often. It depends on how busy your ortho practice is. If you're working 4 days a week and you're seeing 200 patients a day, you probably need to change your filter more frequently than an office that works 3 days a week and maybe sees 40 to 60 patients.
Okay.
So what's the traffic in your office, how, that you need to change that filter. And I would suggest at least once a quarter, if not once a month, depending on the traffic with it. And then you want as much fresh air coming into the building as possible. And we use an indirect way of measuring that, looking at the carbon dioxide. Because the more densely populated we have the office, more patients, the team members in the office, if that carbon dioxide where we're exhaling each time gets above 800 parts per million, then the risk of acquiring an airborne infectious disease is greater. Normal outdoor carbon dioxide levels are at 400 parts per million. So keeping a simple CO2 monitor that you can buy online in the reception room and in the open bay area is a good way to monitor, do we have enough fresh air in our office? And then I would definitely check with the vaccination status of all your employees. I think that's important. We've had new team members join our offices as we had some maybe early retirements during the pandemic. If you have a team member who was not vaccinated as a child, then they're going to be at high risk of acquiring an infection.
Right.
And especially for, say, young women in their 20s and 30s who could possibly be pregnant. If they were not vaccinated and acquire a measles infection, then it could affect their developing fetus.
Okay.
So again, recommending they go get that vaccine. It's one of the vaccines recommended for all healthcare providers by CDC in the U.S. And even if they haven't been previously vaccinated, if you had an outbreak in your community and a patient was identified as infectious, then go get that vaccine right now. Because even having that vaccine before you develop signs or symptoms can help reduce symptoms or even prevent an infection. So it wouldn't be too late to say, oh, I've already been exposed. The vaccine won't do me any good.
Okay. And then what should offices do if there is an exposure in their office?
Because the disease is so highly infectious, let's say you do have that patient come in and you do the oral exam and you see the lesions and you go, I would go ahead and notify patients that, there has been a measles outbreak in the community. And it's been identified within your office because of the risk. You want to notify patients, and if those patients have any unvaccinated family members or patients that were in your office within the last 5 days or so, because again, patients can be infectious before they show signs or symptoms, and then they're highly infectious for that 3 to 5 days afterwards. I would say, please watch for symptoms. And if you do observe symptoms, please immediately go for a measles vaccine, see your physician, and go for a measles vaccination. And I would say watch for symptoms for 14 days because the incubation period can be anywhere from 10 to 14 days with measles. Okay.
And then just to go back to keeping the ortho team patients safe, what are the masking? What do you recommend in terms of masking just to keep the practice safe?
Well, there's a debate, and it's just going to be an office policy at this
Okay.
time. Ortho offices need to watch for postings on their local health department
Okay.
about airborne diseases, especially such as measles, and we're going to see other emerging and re-emerging diseases in the future. So you just need to stay aware of community transmission in your office. Verify that you are current with your infection control standards, with your know what your disinfectants are. Are they effective against healthcare acquired infections? And speaking of that, EPA, which regulates disinfectants now, just published a new bloodborne pathogens list that is called the EPA List S. And
Okay.
it combined about 5 different lists that EPA had. So you want to make sure that your disinfectant that you're using is on that list S,
Okay.
as a healthcare disinfectant. Review your airborne disease transmission precautions, and then screening patients with it. Wearing a mask is always, from the respiratory disease system, from October until April,
Mm.
a wise precaution. It is a prevention with it. And it doesn't have to be that N95 respirator mask. It can
Okay.
be a level 2 or a level 3. Both of those procedure masks provide the same level of particle filtration with them. The only difference is a slight fluid increase with the level 3 on there.
Okay.
So it would be wise to wear that mask as a prevention for both the front desk team
Hmm.
and the clinical team, because
Okay.
this disease is not one that's just transmitted in blood or saliva. It's
Right.
airborne. So
Yeah.
the entire team needs to be protected. And many hospitals during this season are re-implementing mask protocols for both visitors, patients, and staff during this time, especially during a community outbreak. So you have to use good professional judgment
Hmm.
and keep up with community transmission of diseases in your area.
Right. And they can find that information through their local health department.
Their local health department, and I have in my Google alerts. That's what I go through
Oh,
every
okay.
morning. What pops up in the
Hmm.
entire United States and even globally on dental
Oh, okay.
safety and infectious diseases. But the health department and both the media has been good to alert
Hmm.
about the outbreaks that are in Florida now. I know this morning I saw 3 new cases that were just in Michigan.
Right.
And when you have an outbreak there, it can spread like fire through a community because of the high infectivity and the airborne disease. So keeping up with your local health department is one of the best ways to stay informed.
Okay. And I know you wanted to make a recommendation to doctors to visit the CDC website page focused on measles. Should they know
Well,
about
as the
that?
cases started re-emerging, I thought, I need to review what are signs and symptoms, complications.
Yeah.
And the CDC, this is another improvement that we're seeing post-pandemic with it. CDC is updating their website.
Mm.
I didn't realize it, but there are over 220,000 web pages
Oh, wow.
in the CDC website. And if you've been looking for information, and especially during the pandemic, we would all spend maybe 2 or 3 hours trying to find a
Right.
specific page with it. They are in the beta test now. I was privileged to sit in on the initial introductory meeting for that last week, and it's going to be a huge improvement. Much more user friendly,
Hmm.
easy to locate information with it, and we won't lose information as the CDC's revamping their
Hmm.
website. Some of it it will be archived, and it will
Okay.
still be available if you want to do a deep search on it. But
Hmm.
it's going to bring up the more relevant information, and as things change, that they'll be posted with it. So I looked up measles on the CDC website. You'll go to the main page, then go down to what healthcare professionals need to know. Click on that, and there is an educational video and the same PowerPoint slides that were used in the video that were posted in last fall, and
Okay.
it was from what's called COCA, and it's the communication on for communities on issues of health for CDC that they put out. And they do COCA calls routinely with emerging issues such as measles with it. And just reviewing the PowerPoint slides, it took me about maybe 5 to 10 minutes to click through about 40 of those relevant slides, how the disease is transmitted, what are the symptoms, what's the prevention with it, and what are the risks or complications with the disease. I think it's wise for every doctor and for the clinical team to quickly review those slides. If they prefer to listen to the video, they have the option of listening to the video just to update themselves on measles and the measles complications with it and how it could affect the orthodontic practice.
Okay. Well, we will provide a link to that measles website as well as the direct page for the video, and then a direct page or direct link for the PowerPoint slide. Jackie, as always, it's great to see you, and thank you so much for all this information.
Well, thank you for sharing this information. I think it's very timely, Allison. And my hope is that this measles infection will just be a little blip. But it's wise for us to share the information in case there is a bigger spread with the communities. And the orthodontic team knows how to care for patients safely and to prevent transmissions in their office. So thank you for sharing the information about the AAA's Orthodontic Staff Club and the AAO being proactive in sharing this information, and for getting the information out. There are always emerging issues that we can do to be the best in our orthodontic practices.
Exactly. All right. Well, thank you so much.
As always, thank you for joining us. Be sure to subscribe to the Orthodontic Products podcast to keep up with the latest episodes, and be sure to check out orthodonticproductsonline.com to keep up with the latest industry news. Until next time, take care.